I'm here with Claudio Trindade. Claudio, I'm so happy that you're here. You're talking about a very interesting device to correct for, if I'm right, both presbyopia and for corneas that are not regular. Can I get you to talk about it a little bit?
Yes, exactly. We're presenting our initial results with a new type of intraocular implant. It's a new concept of intraocular implant, which is based on a very ancient principle, which is the pinhole principle. And it's pretty much a black implant with a small central opening, and it's supposed to be implanted in the ciliary sulcus of a pseudophakic patient, similar to a piggyback IOL. And by having this pinhole implant inside the eye, you were able to both extend depth of focus and improve vision in cases of pseudophakic presbyopia, and also improve vision in cases of irregular astigmatism, such as after radiokeratotomy, after penetrating keratoplasty, and other cases of corneal irregularities. And since it's based on a very solid principle, it is able to reduce the size of the circle of confusion on the retina and improve vision in those cases.
Claudio, I assume that there is, well, first of all, obviously there's a little tiny pinhole in the center that is loosened, and around that is an area of occlusion, and then beyond that it is once more clear?
No, it's actually well, it's pretty much, it has a central optic which is 6 millimeter. So it pretty much covers the entire optic of the primary IOL, and it has a 3 haptic design to ensure good centration. And so it has a IOL platform similar to a piggyback IOL platform.
And I'm sure that centration of the device must be critical.
It is critical, and you want the pseudo-pupil to be inside the pupillary area. So this is why it has 3 haptical elements to ensure good centration and stabilization in the sulcus. That's why it has this design. And
in practical terms, what are the optical results that you're getting with these patients?
Well, these patients that have irregular corneas, they usually have really suboptimal spectacle corrected vision. So it's hard to get a good refraction from those patients. And they have really dysphotopic symptoms usually at night, and by reducing the impact of the corneal aberrations on the optical system, these patients have really great improvement in uncorrected vision and are able to function much better.
Now, what is the trade-off here? I mean, obviously, I would guess that in mesopic and in scotopic conditions that the vision must really drop off. What are some of the visual prices that the patient has to pay for this?
Well, usually those patients are really unhappy with their optical quality, and they might lose some retinal luminance after the implantation. But the benefits of improving the image quality, I think, outweighs the reduction of luminance. And none of these patients complain about dimmed vision or any problems at night, even at night. And I believe that the most important trade-off would be possibly well, it's kind of hard to think of a complaint that we've heard of those patients.
Right, because these are patients who are coming really in with complaints to start out with.
Yeah.
So, how difficult is the lens to implant from a technical standpoint?
Well, the lens is made of a foldable hydrophobic acrylic, and it goes in through a single 2.2 millimeter incision. We usually use a disposable cartridge to do that, and so it's pretty much the same technique as a simple IOL implantation. And I think this is what it's most appealing to most surgeons, because it's a very simple technique, and surgeons feel they're in their comfort zone. They're not doing anything different from what they're used to.
Is the vision comparable to literally holding a pinhole up?
Well, yes, it is. It's very easy to simulate the results preoperatively just with a pinhole occluder, and so this is why patients get really motivated preoperatively, because it's pretty much similar to the results we have.
This is really neat stuff, Claudio. I'm really glad that you brought it to us, and I'm grateful that you're so generous with your time with us today.
Thank you. It's my pleasure.